A very good afternoon and welcome to our session on the topic Care of Infants and Toddlers. We are glad to have Dr. Abhash Kumar Pani among us today to help us understand the topic. The doctor will take us through that and more in the session today. If you have any doubts, any queries, just put that on the comment section. The doctor will take all your doubts by the end of the session, so stay tuned. Doctor, you have the stage.
Hello, good afternoon, everyone. I am Dr. Avash. I am pediatric consultant in Apollo Cradle, Kondapur in Hyderabad. So today we have decided to discuss little bit about care of newborn infants and toddlers, like 1 to 4 years olds. So the reason being, this is a very difficult group to take care. Initially, in the infancy, when up to 9 years or 1 month child is not that mobile and the needs are little less. So, although people might be thinking we are presently having 6 months or 4 months babies, it is very difficult and nothing can be worse. But actually, in my opinion, that is a bit easier to manage. Bigger children are more difficult and more risk actually is there because infants are staying in their own beds, they are not moving anywhere, newborns. So that's why I wanted to tell little more about bigger children and toddlers, in fact, up to 3 years old, 1 to 3 year olds. So usually 6 months to 3 years, you can say I can cover today. The topic is very extensive and all the points cannot be covered, but I'll try my best. So first, most important, people what ask is the nutrition. The first 6 months, the child is like on mother's milk mostly, ideally, or formula milk in case there is any issues. So once the 6 months mark is reached, then the whole thing starts. How to start complementary feeding for my baby. Apart from mother milk, the other rice, dal, other foods, that solid foods, how it is started. So few minutes I'll tell about nutrition first. So once the baby is 6 months old, we start the complementary feeds. Complementary means previously it is called weaning feeds, like as if we don't want mother milk and we are weaning from something bad, which was not in a positive sense. So that term has now changed to complementary feeding. So something that is complementing the mother feed. So we start with liquids like dal, water is the most common thing. Sometimes little juices can be given also, but juices being very sweet should not be given too much. So usually people start with dal water, and then slowly rice and other semi-solids are added to it, and mash is done by the hand. So initially it will be a liquid type for first 15 days, like 6 months to 6.5 months. Semi-liquid type of food is given, like a few spoons, 1 or 2 spoons, two to three times a day. Slowly, as the age progresses, the semi-liquid is made into semi-solid. Any food can be given, like idli, chutney, or sambar and rice. I mean, there's no such thing that cannot be given, but usually because it's a newly we're adding the food, we will be adding 1 or 2 new items, new food substances per week. So that by 9 to 10 months of age, like there are only between 6 to 9 months, there are only 12 weeks, so not a very big time. In 12 weeks' time, we'll try to make the child aware of all the common foods that we are going to take. So by 9 months, slowly the quantity will increase from few spoons to maybe this much half katori. 3 times a day we can give slowly. Then by after 9 months, we can make it full katoris and make it 4 times a day. So that is the usual, and consistency will be semi-solid. Slowly after 9 months to 12 months, then the mashing should come down. By the 12 to 14 month mark, the child 12 to 14 month mark, child should be eating everything. And then initially sugars and salts and oil and masala and all should be not there actually initially. By 9 months we can start adding these things gradually, so that by 1 year, 1.5 1 year, 1 month, 2 month age, child is eating everything almost with no mashing. By the 13th, 14 months, normal food should be given to child. So that is the thing about nutrition. And cow milk, major people will ask when to give cow milk. Can I give right away? So medical literature is suggestive of cow milk at 1 year of age. Why? There are chances of allergy with cow milk, more chance than mother milk. So best is to go for mother milk till 1 year at least without any outside milk. And if you want to give cow's milk, it should be after 1 year of age. But in the hard case, if due to any reason mother milk is not there and formula milk sometimes are not preferred by the patients, people, then we can go for cow milk also. But ideally after 1 year of age. Next is honey. Honey is the very preferred because it's sweet. People try to give honey to children, and it's supposed to be very nutritious and health benefits are there numerous. But we have to understand that honey can cause infections, especially in newborns. So below 1 year, honey should not be given. Above 1 year, if somebody wants, little bit honey can be given. And then uh, for bigger children, feeding should be trying to be independent. Let them eat on their own. That mashed food after 1 year, 1.5 years, child should be eating with spoon and katori on their own. Not that the mother will be running after the child and eat and eat. Not force food. Do not force feed the child, and do not go for distraction. Like very commonly, where you're seeing TV and mobiles to be being used to distract the child and just put the food in the mouth, and child is just without understanding it because something is there in mouth is swallowing as a reflex. So these things should not be done actually because in the long term they can cause means child will not be able to have a proper attitude towards food, and they will go into the junk food, and they will become obese actually. So many other practice that should not be done is using a grinder or a mixer or any stone, either a mixer which is electrically run or using a stone and thing. People grinding the food too much. So that I have seen some people they are using this finely grinded food till 18 months to 2 years of age. Those children will never eat normal rice dal vegetable in their means up to maybe they are 8 to 10 years old when they start have full understanding of the situation. What they want will be after 2 years they dislike the liquid diet that is being given to them, and then they cannot eat. They don't recognize the rice dal vegetable in the usual form that we eat, and they are inclined towards junk food directly. So there's a high level of obesity in these children also. So do not use this mixer grinder at all. Initially mash with hand only, but little more. By the 9 months to 10 months, start decreasing the mashing. By 12, 13 months, there should not be any mashing. This is very important. Okay. So now that we have covered the nutrition part, then there is a question of health drinks. So usually after 2 years only, health drinks can be allowed. On the packaging also it's written health drink at 2 years of age. Next comes the growth and development. So, how to know growth and development is occurring correctly or not? There are certain red flags which can tell us that growth and development is beyond the acceptable limit. So, first is the sitting without support. Sitting without support comes at around 6 7 months of age. If by 9 months child is not sitting without support, it's a red flag. Similarly, it is standing without support and walking. So if it is by 12 months to 1 year, 12 to 13 months, child should be standing without support, and 14 months child should be walking without support. If it is not occurring by 16 17 months, again if child is not standing without support by 16 17 months, then it is a red flag. Like that, these are the major milestones where we can think that child may have some developmental delay without, I mean, if he is not able to do these things. Excuse me. And then development also occurs in there are one is the this is called gross development, gross motor. Then there is fine motor when he is able to hold the things and put things in mouth or manipulate the things. Fine motor development using this kind of pencils by 1 year of age, using it in a pincer grasp, it's called pincer grasp is this, sorry, two, this is by 1 year, and this one by 14 months, this should be there, three fingers thing, and he should be able to write, I mean not write, scribble on the chalk, I mean on the paper. And then there is speech. Speech is usually by 2 years of age. Some bisyllables should be there by 18 months, and by 2 years, one or two words with meaning child should be telling. So by 2.5 years, if there is no speech and all, then definitely child will need speech therapy and evaluation for other illnesses like autism, especially if he is not able to understand. There are many situations where child is understanding everything but not able to speak. That is somewhat safe zone, and little bit of speech therapy may help in quickening the acquiring the language skills. But if child is not understanding at all by 2.5 years, then autism has to be considered and evaluated. And then there is emotional and cognitive development. So child is able to recognize the other people, and then interact by 2 months child should be recognizing mother. So social smile should come at 2 months. Like that, by 8 9 months there is stranger anxiety. If stranger coming to child, he'll start crying. So that is also good. That means child is able to recognize who is the family and who is stranger and reacting accordingly. So stranger anxiety at 9 months, 10 months should be there. Like that, after 2 3 years of age, 2 years of age, child should be able to play with other children, interact with other children, and little bigger child, 2.5 3 years, should be able to interact with strangers also, talk with them. What is your name? All those things you should be able to answer by 3 years of age. So this is somewhat about development. Then comes the growth. Growth, there are certain parameters like height and weight and head size. So these are monitored by using growth charts. So these growth charts are with all the file of the child will be there. We are providing the hospitals are providing growth charts to the children. Even in the government, the vaccination card also has a growth chart. So growth can be plotted in the chart with each hospital visit during vaccination, so that they can see that the correct line the child is following or not. So growth chart has a range. At any given age, there is a lower. The normal has a range. So lower part of lowest of normal to highest of normal. People often confuse. They want the child to be here in the highest of normal. Anything below, they'll say child is not growing properly. That is not true. So the graph is like the lines are like this. At any given age, there is a lowest and a highest. So child should be anywhere in between and following one particular line. Suppose middle of normal line or lowest of normal. If it's following one line, then there's nothing to worry. If it's becoming flat, cutting across lines in the graph, then it is something to if consider that if there is any issue or not. So growth is evaluated by the growth charts. Parents can do it themselves also, and of course, when they visit the hospital, they should get it done by the pediatrician so that they can track the growth of the child. And then there is the behavioral issues of behavior of the child should be appropriate. Some children we are seeing they are throwing temper tantrums, head banging. Then there is something called apneic spells. So the child stops breathing after such some after a uh, after a stressful episode, child stops breathing for some time, scaring everyone. That is, these things are the behavioral issues which needs to be addressed. So, how to improve the behavior of children by decreasing the exposure to gadgets. Nowadays, we are seeing, especially because of lockdown and Corona scare, a lot of people are giving the gadgets to children. Even the school children are provided online online classes. The children are exposed to gadgets at a very early stage, and then they are not interacting with other people. They are just simply looking at the screen and looking at the cartoons or something like that. Even they are developing the language like the cartoon characters are speaking in a American type of shrill voice. Children are talking, even normal children. So these things, this gadgets should be decreased and interaction with people should be increased, like parents and any other extended family if available. Then play groups, play school, neighbors. So all these things, and even storytelling at night is very important. When bedtime stories, the tradition was there before. Nowadays it is slowly dying out. So these all will increase the emotional emotional development of the child, and even the mental behaviors also, and even the mental abilities of children. They can their so-called emotional IQ will increase. They can interact more with other people. They can understand the feelings of other people, empathy. All those things will be more in the children who have been away from more, not exposed to much of gadgets, but more to people. So that we can do. And most another routine thing is the vaccination. So as I told, in the routine visits to the hospital, there are various vaccinations to be done. So please do not forget the vaccinations. I have seen few cases where people have simply forgotten. Like after 1 year, and again they come after 5 years saying, oh, somebody told next vaccine is 5 years. So please go through your vaccine chart. Do not remember something that somebody has told vaguely. In the side of the vaccine chart, the age is mentioned. It's birth, then 6, 10, 14 weeks, then 6 months, 9 months, 1 year, 15 months, 18 months, like that clearly mentioned. So please go through the vaccine chart, and every time you go visit the doctor, please carry the vaccine chart and growth chart. It will help in writing down, I mean, recording the status of the child so that nothing is missed. Now, the most important thing which I wanted to tell today is the safety. Safety is what toddlers, what I told, up to 9 months, it is relatively easy to manage the child because he's at one place just to provide the food, cleaning, temperature, and emotional warmth, emotional care. That much is enough. Once the child starts crawling at 9 months, 9, 10 months, by 1 year, child is starting walking. The real challenge starts there. So how to make the child, how to make the environment of the child safe. So there are many things, like first is poisoning. So what happens in the child, in the room, in our house also, there are many things which are poisonous to children. For most common and most important is the medicines kept in the house. Some grandfather or even father, mother are having some hypothyroidism, blood pressure, diabetes. Those medicines are kept. The child goes and swallows 10 diabetic medicines. You understand, no? So these medicines should be totally locked and kept in a high shelf with lock and key. Never trust the children on anything. I thought child will not do like this. I thought, suppose one small example, people keep their child on the bed and the kitchen, that whistle comes of that cooker, and by the meantime child has fallen down. The story they tell us is, I just went to just switch off this thing, switch off the gas, and I'm coming, and this has happened. So never assume that the child will not do anything. Please, this is very common that child does something which is unexpected. So expect the child to do something dangerous. So please take the precautions. In case of poisonings, the household items, these things which are dangerous items should be kept in the lock and key. First is the medicines of the people already in the house. Second is the toilet cleaners and acid. And then third is the kerosene. In some households, still people are having kerosene and oils, which is accessible to children. These are the poisonings. Then there's the accidents. In the modern houses, there is a staircase just outside the house. There's staircase. Some houses are having staircase inside the house also. So those staircases has to be barricaded and locked so that child cannot open. The top of the staircase and bottom both should be having wooden barricades with lock and key. Then there is the car accidents. In India, better not to tell all these things because in the adult side also we are in a very bad situation. Car seat, if child is traveling in car, mother holding the car, I mean mother holding the baby in the hand is not sufficient. There has to be the car seat, that infant seat should be there, which is put in the car, and all the safety click locks are there, and seat belts are there. Child is facing backwards. All those things are to be done. Car safety. Next is asphyxiation, like child is putting the polythene cover on the face. Some children are playing, they are putting the polythene cover, and then child is asphyxiated. The oxygen doesn't go inside. So these polythenes are provided with small holes. There's no accidental asphyxiation, but these things has to be strictly monitored by the parents. These items should not be left lying around in the house. Next is strangulation and choking. Strangulation means electric items are having cords, like this mouse is having cord and wires. So long, loose things should not be left. Child will, suppose there's a electrical board and 4 5 items are there. So wires are all around. Child will crawl into that, and he'll start playing, and somehow this will entangle his um, this thing, throat. I mean, yeah, neck. And then there's a, now the TV has become safe because it's panel TV and attached to wall. Previously, we have seen many cases where child, that other CRT TV is there. Child is like playing with that table, and the TV is falling on the child, and mostly it ends up in bad fatalities because heavy TV is there. No, so that is the thing. Then there is choking. Choking is extremely important. So toys, small toys and small, like cashew nuts. Suppose people think cashew nuts is very healthy, they are giving to a 2 year old child. He will choke. 2 year old child cannot eat cashew nuts mostly. So toys, small toys with like poor quality toys with that wheels will be very loose and they come out this size wheel, child will eat. Buttons, especially some dresses have one hood like this, and there's a string here, and there's a plastic cap on the end of the string. That plastic cap is having another small plastic cap, so child will put it in mouth and he'll swallow that plastic cap. It goes into lungs, devastation occurs. So small objects should be removed from the house. If there is a up to 3 4 year old child should not have access to small size objects, including in the kitchen and including his own toys. So this is one thing which is very important. Then there is submersion injury. Submersion injury, two things are coming to my mind. One is the swimming pool, which is there in the communities. That is, few cases I have seen where, I mean, personally I have seen, and many cases I have heard where the child of 2 years old or 3 years old or maybe 5 year old also, he has gone there. There is no lock in the swimming pool area, and there's no lifeguard. Nobody is there. No watchman, no guard, and that time no parents or any other was there, and he is drowned in the swimming pool. Numerous cases are there which submersion. This is swimming pool. Second is inside the house, bathtubs are there, or sometimes buckets are there. Small child with a heavier bucket, if it is half filled with water, he goes and plays with the bucket, and he can just simply, just as a half bucket, nothing is there. Child will be playing with the bucket, he'll simply rotate like this. Head is heavier in the children, head and top of the body. Legs are little small and light. So naturally they want to fall inside the bucket. That much is enough to take the life. Just this much level of water in a 1/4 bucket is also enough. So these buckets and bathrooms should be very secured, and water should not be left lying around. Child should be supervised when he is playing with water. And one of the next is burns. Burns means like fire or hot water. Most common, this is a favorite of everybody, to use steam inhalation. So steam inhalation during cold, that's a very controversial topic. For me, it is very controversial. I do not write steam inhalation to anybody because the benefits of steam are not so well proven in medical science. I can say many people are using, and I have seen personally worst burns even in adults and in children. The most dangerous situation is kitchen utensil, some saucepan or something like this being used with boiling water, and the person is putting on cloth like this and inhaling. The cloth itself pulls the thing down and it falls on the lap and legs and even sometimes arms. So that is, the steam inhalation is very very dangerous. I strictly discourage steam inhalation. Second is hot waters, like child goes into kitchen and puts his hand inside. So while the kitchen things are being done, cooking is being done, there's fires and hot waters in kitchen. Obviously, no need to tell that. And then the other thing is hot tea and coffee being kept somewhere in the house and child has poured it. So these are the few things where burns can happen inside the house. So the safety of the child, that is the most challenging, because the variety of the unsafe things are mind blowing. So you have to be very careful and fanatical about it. In modern houses, there are many things which can go wrong. So one or two points I would like to say regarding the toilet training. Toilet training maybe at 2.5 to 3 years. 2.5 is usually where the toilet child can speak that he needs to go to the toilet, where the toilet training can start. So 2.5 3 years, child can remove his garments also. Child can say I want to go and all those things. So toilet training can be thought of at 2 plus, depending on the child's language and interactive skills. And then most important thing is if there is a bedwetting and all, many children do bedwetting up to 7 8 years. Also, bedwetting is common and it's not a disease. Especially in boys, it can occur in 7 to 8 years of age. So main thing is not to punish. Some people go into this vicious cycle of punishing and shouting on the child, or even if you don't raise your voice, your expression and your way of talking also child can understand. So negative way of negative reinforcement will aggravate the problem. So then we should never punish and praise the child whenever he is not bedwetting. That is more important. Bedwetting and all those things. Now last and one more thing is sleep. So there is something called sudden infant death syndrome. So that is not very clearly proven. Many theories are there, but when the families are using cribs, so what happens? The theory is that the mattress, if it is soft, then the child turns over and then the face is compressed by the mattress surface and child gets asphyxiated. So the two things that decrease the incidence of this SIDS is using of little firm mattress, not the soft ones. And then back to sleep slogan was very popular in the US, where more incidents, so they use more cribs. So back to sleep means make the child lie on the back to sleep. That has drastically decreased the infant death during sleep. And then one thing is dental care. Many people are asking like when to start brushing and how to do mouth and dental care. So that I want to speak lastly. This is the today's last item. Dental care is the before the teeth come, like 0 to 6 months, 7 months. You can use a initially cloth to clean the tongue and mouth, gums, and then there's a silicone kind of brush is available that goes over the finger with little bit bristles are there that can be used. And then after 6 7 months, when the teeth starts coming, maybe two to four teeth are there. That time you have to switch over to brush. The brush like what we are using, same brush but of smaller size with soft bristles, of course. And toothpaste are available also for children. So below 2 years, it should be non-fluoride toothpaste. So you take the how much amount of toothpaste, take a smear of the toothpaste like this the surface of the brush. What we are doing, we are keeping like this and squeezing till you get a heap of toothpaste. For babies, children, you can just smear it like this. You hold and press the tube and just smear little bit of the toothpaste and just brush twice a day. Minimum twice a day is must. And the doubt is that what if the child swallows? So anyway, it's safe for babies. And the age-wise toothpaste is coming now. In the many companies, all the companies are having the age-wise toothpaste. So that smear of toothpaste should be taken, and brushing should start as soon as teeth have erupted. At least two tooth have erupted twice a day minimum. So that is for the dental care. Other thing which is very dangerous for, and after each feed, of course, you have to clean the mouth. No need to brush, but at least food should not stick to the teeth after eating. So when somebody is eating chocolate and all that, is very sticky. So it has to be thoroughly cleaned after eating. So one of the most dangerous things which cause the all the teeth to go black and the dissolve away is drinking throughout the night. So many parents have this, babies have this habit of keeping the bottle of milk. Slowly, slowly, baby will be feeding throughout the night. One bottle or maybe two bottles, or even mother milk. Mother milk continuously, if somebody is taking throughout the night for years together, like first year to second year, they are taking without cleaning the mouth in between at night also. How to clean? At least make some drink some water. That milk which is taking to the teeth will go away. So that causes the entire teeth to become means rotten and dissolve away. Simply the tooth dissolves away. It's very dangerous to see, difficult to see. And then the other thing that people say, oh, this is only milk teeth. Anyway, next set of teeth are coming which are like nothing will happen. That is not true. Sometimes this infection can hamper the teeth that which are already inside. That is one thing. Other thing is the habit. If the habit is not changing, then the second set of tooth will also meet the same fate. Then third tooth is not there. So very important to have this brushing and eating habits in children in early life, so that we don't face any major problems in later life. So this is in brief the few topics that I thought I'll cover today. Of course, it is like very vast subject. Newborns and infant care is like not so easy. And any further sessions also you might have in each topic if required. Elaborating suppose on nutrition only, you can have one full topic. Safety, one full topic you can have. We'll plan it out in the future. Thanks a lot. If any questions, please anybody can raise. No problem.